The general impression in Pakistan is that the treatment outcomes in case of poor people are worse than treatment outcomes in case of rich people. Now, that is generally accepted, but is it actually true, or was it actually true? This is an interesting question. Till some years back, when the medical education was relatively cheap and there were no private medical colleges, the students were just paying a few hundred rupees per year as charges for the hostels and the charges for the tuition. Things were humanitarian in nature, and it was not uncommon for newly qualified doctors to be imbued with quite a humanitarian spirit, and even spending, let's say, if they had a salary of a few thousand, they might be even spending about 20-30% of that. If they are single, living in a hostel with few needs, they might be even spending it on poor patients. They were also in a habit of requesting the various drug companies to help with the provision of antibiotics free for the poor and so on. However, I won't say it was another time, but this type of sentiment does exist still. Second thing is that since the poor people don't have very high ego, they tend to be very humble, and this is something which a young doctor appreciates quite a bit, and he is sympathetic sometimes unless there is too much overcrowding. And then the other thing is that once 2 or 3 doctors they decide that an operation is needed, or such and such thing would be needed, or bring this thing or bring that thing from the market, generally if they can afford it, they will bring it. In other words, there is a lot of compliance. And what is the result of this compliance? The result of this compliance is that in the older days, when there were not too many tests around, like scanning and so on, and these types of charges, and basically a lot of things were, let's say, in the surgical field based on the physical examination and history taking, and surgery was a necessity in case of, let's say, abdominal catastrophes, in case of road traffic accidents, fractures, and so on. So the poor people had a great supporter in the young doctors who are attending. And there was at one time a very active zakat system in the hospitals, at least about 5-6 months a year. There were some zakat funds which could be gotten from and paid from in case of expensive chemotherapy or such things, which required a little bit of longer stay. Not only that, among the poor peoples, they have a tendency of living in a very communal type of setting. They are ready to help each other, and it is often quite possible for them to raise, let's say, 1 or 200,000 rupees in about 2 days or 3 days. And an interesting thing is that if there is a need for any blood donations or something, it's not difficult for them to get 5-6 bottles, 10, 12, 15 bottles within about 48 hours, so many donors and so on. Usually the younger doctors, they operate on them, usually registrar level or medical officer level or assistant professor level, and they are quite also enthusiastic in improving their skills. And surprisingly, the outcomes are not usually that bad, because some of these operations which are routinely done, some of them are very old operations of allopathic system, and some of them are more than 100 years old, and they have been faithfully um, taught from generation to generation and so on. So the outcome in cases of, let's say, trauma cases, in cases where transfusions are required, in cases where there is not too much high tech involved in management, the outcome in poor people is not very bad. And one of the reasons is, and there's another reason, that although they may be malnourished, but on the other hand, many of them are physical workers, and they do have a somewhat sturdy body, and might be younger and so on. But having said that, the issue basically is that that was a time when most of the hospitals were government hospitals. There was not very extensive private sector, and doctors, many of them, they did not do private practice. Things change with time, and now the medical students have to pay 10 to 20 lakh rupees per year for the medical school, and then they are saying that there would be some licensing examination, and then there is a competition for house jobs and everything, and repeated devaluation of currency means very expensive medicines, and then we have, I think, some kind of new legislations, the MTI or something like that, I don't know. And these types of legislation, so far as they are put, makes the hospitals not only somewhat autonomous, but also not reliant on any government funding, meaning thereby that expenditure on poor would be reduced. This is not a welcome development for the poor person who is already in a great trouble. Among the rich people, the original question, what often happens? One of the problems with the rich people is that they are very apprehensive. They have hundreds of doubts about the doctor's competency, and then they have children who are tied to the internet, and they read all types of things over there, and their children would be asking questions: will this thing happen, will that thing happen? And you advise them, do this thing, there will be some other advice, do that thing. And I have commonly seen that what will happen is that 2-3 weeks of delay in testing, and they are making up their mind and so on. And what would happen is that the patient would in the meantime deteriorate, or the disease will spread, and he would be immobile, and many of the options would be gone by that time. At the end of the day, I've seen that in many rich families, the outcome is not good. And I've seen also that there are people, for example, I knew a boy, he was, I think, about 21, 22 or something like that, and he was, I think, some kind of science student, and he was treating his mother with some type of suspected hematological malignancy by, seeing the internet, and he was reluctant to have the advice of the doctors, and this thing is quite common. Then there is one of the great tragedies in this country is that we have not really decided, although we have decided on the national anthem, but we have not decided on that which system of medical treatment should receive the clear-cut sponsorship of the state. Obviously, the only complete system with all types of surgeries in which the and all types of medicines and treatments and radiations, and in which the world has invested at least 1 million times more than any other system in terms of money, and the one which is very advancing is obviously the allopathic medicine. But at a state level, there is a tendency to create rivals of this. So we have got homeopathic councils, we have got Ayurvedics, and we have got the ancient hikmat and herbals and so on. The problem which is not that some of these medications, these earlier herbals, these earlier medications might be effective and they serve their time. But obviously this means that the patient is having several inputs, several options, and in none of the other system there is any imaging system to see whether on CT scan some cancer is growing or not, or some disease advancing or not, and it's just generally talk-based systems which the other ones are. And the damage which they do is that they, again, like the questioning of the children of the rich man, they delay the treatment, the most appropriate treatment, and sometimes waste the time period. Next we come to what exactly we get in the hospital. The problem is that some of these private hospitals, they are preferred not because there might be some very superior treatment going on in that, but because they are more organized and they have got better catering service and better hotel type services. In other words, the rooms of the good hospitals are at least what you might say 3 to 4 star hotel equivalent, and obviously it also entails expenses of that type, and because they are private clients, they will not be subjected to all types of harassments which we see in the hospitals. One of the problems in our hospitals is that it is not the doctors which abuse the patient. It is mostly the lower staff which is very strict with the people, and it is not usually the patient who receives the negative number. It is basically the numerous attendants and visitors of the patient which just increase cross-infection in the community and create bad tempers and have really nothing to add to the management of the patient except to add expense and worry. This is one of the big problems, and lots of fights in the hospitals are with these undesirable visitors, and some of them might have even criminal background, and time to time, every month in every hospital there is always some issue of some theft going on or something going wrong or something like that. The standard of management need not be very superior in some of the better hospitals. However, we do expect that the rich get operated in operation rooms where there would be adequate sterilization, hopefully, and obviously there would be disposables in abundance rather than reuse of the same thing. And yes, that would be a more better atmosphere or something. But overall, if the management in government hospitals for the poor and the management for the same level of disease, same type of disease, that actually needs to be properly researched, because people are not convinced that this is a reality. Then there is another problem which has occurred, is that in older hospitals what would happen is that although there would be cross-departmental calls, usually attended by the PGs or the registrars or assistant professors from another department, but because there is usually quite a good strength of the enthusiastic house officers in these hospitals, general hospitals, whatever they write would be read by somebody, and it would be some part of it would be executed. But in case of what I've seen is that in case of some private hospitals, the problem is that sometimes a patient is lying there, and if you see the various calls given and various tests done, he's almost fully investigated and disease has been discovered and everything. But there is nobody of knowledge who is in the special private boards and of these private hospitals who can integrate and make a plan for the management of the patient based on these things. And this is a side effect of having multi-specialists in these hospitals without having a real senior in charge registrars to take care of the patients. Usually medical officers who are not very well trained in this integration of and making plan for the patient, and it's a very funny type of situation it is, but it appears to be the correct situation. Obviously, if it comes to the matters of, let's say, transplants, or it comes to the matters of dialysis, or some of the stenting and these types, and cancer chemotherapy, yes, the rich people have an edge there, and if they have good doctors, they will get more expensive chemotherapeutic agents, and they would be able to get their radiations in better centers and so on. That part is okay. They will get better treatment. But as I mentioned before, that would a patient of trauma or acute abdomen get a better treatment in a private setting, meaning rich people would get a better treatment than poor people? I am not very sure. I am not very convinced of that either. Okay, this is the case. But in case of these special organ failure settings or oncological settings, yes, most probably it is true. And then, of course, there are certain issues in which, although this is an Islamic republic, but there is no privacy setting. I have personally seen that in some of the government hospitals, in labor rooms, it is not really appreciated that in this Islamic country, at least the people who are lifting the ladies after childbirth or something like that, or this type of atmosphere should be females or something like that. And I've seen from male workers from minority communities and just throwing women here and there, and that is when you feel that yes, it is in this context the richer persons are at a better advantage than some of these government and poorer people in the government hospitals. This is regarding the price of medicines. Yes, it is an issue, but there is one point which I must say. People do not realize that experienced medical doctors do have a training of tailoring the treatment not just according to the age and strength of the patient, but also to the amount of budget he has got. It is sometimes quite possible to treat something in 2 or 3 ways, or to manage some problem in a cheaper setting. This is quite possible, and the older doctors used to be more proficient in this, and I think the younger doctors have to be trained to alter the treatment according to the costs involved. And the result of these alternative treatments and expensive treatments is sometimes not more than 10% or something like that. In other words, that if there is a conscientious doctor and if there are some funds available and there are general hospitals and there is some discipline and the catering departments are washed and some of these things are improved, I don't think so there would be much difference in the management of many diseases in terms of outcome between the rich and the poor people. One of the great mistakes I feel people do is to appoint certain doctors in certain posts for which they are not really equipped. For example, a hospital, an average hospital, a big hospital, has basically three aspects. There is one aspect of the catering of the hospital, the food and these types of things. There's another aspect, there is a hotel aspect of the hospitals. And medical doctors, they are often not that good or proficient in the hotel part of things. That means the residential accommodations, the improvement of bathrooms and these types of things. And I sometimes feel that this type of their catering and residential should be involving people who are from the catering and the hoteling background. They might be able to make our general hospitals for the poor at least more sightly and good looking and better, because after all physicians are basically not trained to look at these types of day-to-day things. So with this I would end this, and I would say that proper studies which are carefully controlled are needed to look at the type of services which are providing to the poor people of Pakistan and how can we improve these services, and also to create some awareness among the rich people of buying services, health services which have really some superiority in terms of treatment, and not just a better hoteling type room in a private hospital with not very high class management from the clinical point of view. With this I end this small talk, and I hope that at least I have made my viewpoint clear on this issue. Thank you very much for your patience.